way to Tampa, Florida. And Renee, the beautiful wife, is about to push me through on the wheelchair. We're going to the airport. Let's do it, baby. It's 4:30 in the morning, and we are on our way to the plane. Here we go.
Help.
Uh-oh. Normally we have like a lot of extra help. This airport, not so much, but not so much of a wait, so we'll really complain. All right, we got to figure out where we're going. I will update you in a little bit. Say goodbye, baby.
Bye.
Hey, so we were at the airport early this morning. I think it was like 4:30 in the morning. Well, right now we are in Tampa. And when I last saw you in the airport, my wife Renee was pushing me and she was really cranky and tired. Guess what? She's still sleepy. Hey, baby. We didn't get much sleep. I'm just on a natural high because I am in Tampa. I'm doing my stem cells tomorrow, and I'm going to bring that right at you guys and show you the process and the building and all that good stuff. So anyway, I'm in the rental car. We're driving around exploring. We're exploring in Tampa, Florida. I'll catch you later. Alrighty, today is the big day. It is Wednesday morning. And in a couple of minutes, I'm going downstairs from the hotel room to catch the shuttle. That's going to take me right to the Lung Institute. And I'm going to start the lung stem cell procedure. Just going to give you a little view from the room that I'm sitting in. It's the Aloft Hotel in downtown Tampa. Let me see if I can switch this over. I'll be right back. There we go. I'm back. There's a view from the room. It's right by the river. They call it the River Walk, which is kind of neat. There's like a nice little walkway that goes all the way around downtown Tampa. Looks like Channel 8 News is right over there, which is kind of cool. And that's the view. Anyhow, I am on my way downstairs to be right back. They got to make it easier to switch these things over, huh? I'm going to head downstairs now. I'm going to pick up the shuttle and be reporting to you in a little bit. Bye. Alrighty, hey, here we are, Donnie P here with Renee, and we are standing in Tampa in front of the Lung Institute. They say it's on the 4th floor, so let me spin this around and give you an idea. There we go, there's the building. Yeah, I could really work a selfie stick pretty good, huh? Anyway, so they're actually coming down to greet me, so I'm going to see them in a second, and I will let you know how it goes. See you in a little bit.
All right, we got you.
Cool. Wow, so this is where the magic happens.
There you go.
Cool.
All the good stuff for you.
Mm-hmm.
So that's just in a normal saline solution or the stem cells?
Correct.
Okay.
That's really cool.
Yeah.
So this shouldn't take too long at all, and then, all right. Well, what I'm gonna go over is, I know Melissa took your blood. So what happens is the blood gets put into a cup like this. We walk this 5 steps into our lab, which is right here in the office.
Mm-hmm.
We take your blood and we put it in a cup like this. The cup is placed into a centrifuge machine where it spins very, very fast, and that separates the blood products, okay? So this here is your red cells.
Right.
We don't need those for what we're doing, so we discard all of that. This amber colored stuff here is your platelet poor plasma, and nothing that we really need in there, so we discard most of it. So this is the big question. Why do you take so much blood? Well, this is why, because this is what we end up with out of all that blood we take.
A little bit of stem cells.
So down here, this dark red spot is your platelet-rich plasma.
Okay.
And that's really important because that is basically the whole show. So that has growth factors and anti-inflammatory properties and things that are in that really help support and set the stage for the stem cells.
Okay.
So without them, stem cells wouldn't do what they need to do.
I got you.
So they're like the little worker bees. They do all the work, and then the stem cells come in like the queen bee, like, where's my stuff? And just goes in. So it's very important that we have that go in with the stem cells.
Gotcha.
And your stem cells are in this layer here, in this buffy coat layer here. That's where the stem cells are. So we mix all of that up there, and we put it in through your IV. The IV is in the vein of your arm, and the very first place the vein takes that is to the right side of the heart, and the very first place the heart pumps it is to the lungs.
Correct.
And as the pipes get smaller and smaller and smaller, that's where they'll get trapped. That's what we call the pulmonary trap. More than 80% will get stuck there. There was a really cool study that was done where they took stem cells and they tagged them with an isotope that lights up under X-ray, and they did just like we do. They reinfused them through the IV, and then they put the patient under the X-ray following it, and the lungs lit up.
There. Wow.
Incidentally, that patient also happened to have carpal tunnel syndrome, so there's a little bit that lit up in the wrist.
Oh wow.
So
does it tend to go where the body needs it?
yes, so there's signaling. There's signaling that happens when there's inflammation or diseased tissue. There's signals that are let off, and that lets other cells know, oh, you're needed over here. We need to go over there. And stem cells are attracted to those signals.
Gotcha.
So, you know, you've got them going off in the lungs. We're getting them right to there. They're going to get trapped from the capillary system in the lungs. So that's how we know for sure that they get to where they're going.
Right.
Okay, it's not overnight. These are microscopic. So just like when you're building a structure, you've got to lay the foundation and put up the framework. That's kind of the same thing. So this is not going to be like you wake up next week and oh, you're a new man.
Right.
That would be fantastic, but that's not real.
Right.
It takes on average for our patients to feel better in about 3 to 6 months.
Okay.
And what does that mean, feel better? You may or may not see huge jumps in your pulmonary function test. Our goal is to make you feel better on a day-to-day basis. So quality of life. That's why we gave you that questionnaire when you first came in.
Right.
That's your baseline. So once we will call you at 3 and 6 months to repeat those questions to find out what has changed in your day-to-day living.
Okay.
Are you now able to come off the oxygen that you periodically need during the day?
Right.
Are you able to walk further before you're completely out of breath?
Right.
Are you able to be, maybe for you it's more stabilization, right? Because it sounds like you never know. You wake up and you're not quite sure what your day is going to bring, but maybe it's a more stable plane for you.
Sure.
Those are the things that we're going to be looking forward to. So those are the questions that we'll be asking and following.
Okay.
What else do you need to know? That's pretty much what I start with. If there any questions, I can start to go over any questions you might have at this point.
You pretty much answered them.
Okay. The other thing I'd like to point out is this is not a cure. So this is not going to make your lung disease go away.
Right.
And it's not 100% success rate. So not all of our patients get improvement. 82% of our patients are expected to have improvement in their quality of life. And of those,
And
some
that's
of
for
them.
different types of lung diseases?
Correct.
Or
Correct.
different percentages for different disease types?
We haven't separated. We're actually doing it right now where we're separating out diagnoses and looking at the data based on diagnoses.
Okay.
What I can tell you is that in some cases, we don't have enough data in one specific category to make it statistically significant.
Okay.
The big players like COPD and pulmonary fibrosis, we have a lot of those. But when you get down to like BOOP or sarcoidosis or things like that, I'm not quite sure if we're going to have, at this point, the numbers we need to make that data statistically significant. But that's coming down the pipe. We are going to be looking at those.
Right.
And that's where we were looking at your data up front to see what category are we going to put you in. You might be in a separate category of like mixed.
Where are you putting me? Mixed?
Probably, yeah, because that happens sometimes. Patients have more than one lung disease, and so it's not really fair if you include them in a diagnosis where it's all just one type. So
Oh, that makes sense,
yeah.
and that's what the doctor said in the hospital. We're really not sure what you have actually.
Right.
So it could be. It sounds like mixed is right.
It might be. So and
Under the banner of ILD.
Correct, and that's the interesting thing. I think the longer I practice, the more what my high school teacher told me is so spot on. The more you learn you don't know.
Sure.
So, and there are always new diseases that we're finding out about, new situations, new diagnoses. So maybe it's something that just hasn't been diagnosed yet. You might be very, very unique in that way.
Wow. I've been told that.
So, special is good. And that's pretty much what you can expect. So all 3 days you're going to have this treatment. Okay. The other thing that we typically give, we do not give to asthmatics, so we're going to hold it just because we're not sure.
Okay.
With you having significant improvement with that bronchodilator, I'm just not comfortable with giving you this without knowing whether you have asthma or not.
Okay.
So what we usually give is a nebulizer treatment with something called glutathione. Glutathione is an antioxidant, which with all your supplements, you're probably familiar with what an antioxidant is.
And glutathione as well.
Okay, perfect. Do you take it?
No, but I'm looking to take that.
Okay, okay. Well, when it's nebulized, there's a risk with asthmatics. It can put you into bronchospasm. So that's why I'm not giving that to you. There are oral supplements that would be okay to take, but we give it nebulized here. And so antioxidants help clear out free radicals. So what that, in layman's terms, antioxidants, garbage collectors, and free radicals, trash. So they just go in and help clear out those free radicals.
Should I take that in supplement form or no?
I don't think there's a problem with you doing it. What I like to tell patients is that with the nebulizer treatment, there's no direct effect on the stem cells, so it's not going to multiply them or give them super strength. So it's not going to affect your treatment in any way. It's just an additional thing that we give to our patients.
Right. Would you see a difference possibly? I'm coming back in 3 months for the second treatment with my potential asthma.
Right.
Would you know if I had it then or not as far as the inhaled glutathione that you wouldn't give me now? Would I be able to get it then?
I think we'd need to have a specific yes or no from your doctor. Like your doctor would need to rule it out
so
for
see
sure.
him in the interim and do I have asthma or not?
Correct, correct. In
By
the interim,
then, you'll see Dr. Hall in September.
Yes.
So you'll have a definite on
You're right.
asthma.
I'll surprise him with. I'm not taking anything you gave me. Sure.
Yeah.
So we can re-look at that when you come back. Okay.
Okay.
So yes, so you'll have all 3 days here. We're going to do this blood draw. We'll reinfuse, and then in 3 months you're going to come back and have another round of 3.
I gotcha. Okay.
Okay. And that's pretty much it. Any other questions that you can think of at this point?
I think I'm good. Thank you very much.
You're very welcome.
Informative. Okay, hey, I am back from the Lung Institute, and this is going to be my first posting. I had my first treatment, 1 out of 3, and I got the pink bandage on the arm to show you my medal that I got. All right, well, that about sums up the first day. I'm very encouraged, very happy to be bringing this information to everybody so you can see what I'm doing for myself. And a lot of people are asking a lot of questions, so feel free to write, give it a thumbs up, leave some comments down below in the comments section. And as I say in all my videos, remember, live inspired.